All right, so our question reads, a client with angina pectoris received nitroglycerin tablets sublingually for chest pain. The client reports a severe headache after the medication is administered. What interpretation should the nurse make based on the client's statement? And our options are, this is a common but unhealthy response to the medication. This common response will diminish as tolerance to the medication develops. This is a response caused by a cerebral hypoxia induced by the medication. And this is an adverse reaction that should be reported to the prescriber immediately. So, in following our three-step strategy, right, our tootRN three-step strategy, and if you don't know it, go back in the videos. I have a video on this. First thing is looking at your question, and we want to establish very simply what is the question asking. And why do we do that? Questions can become very wordy. It's easy to get confused, especially when you're in this very high stress scenario of taking your test, right? Whether you're in class or whether you're taking the NCLEX. So we just want to look at the question and be able to say, all right, what are you asking me? So very simply, it's saying this client's taking nitro for chest pain. Now they have a really bad headache. What do I make of that? So that's what I'm being asked here. So our step 2, and I'll put 2 over here. Our step 2 is to identify what the problem is in the question. And when I do that, I want to know, what do I know about the problem and what do I expect about this problem, right? So what's our problem in the question? Problem is the person took nitro and now they're having a really bad headache. Well, what do I know about that? I know that nitroglycerin is going to cause vasodilation, and I know that vasodilation can give you a headache. So this is an expected outcome of the medication. So I'm not too worried because I know that's what's going to happen, and that's part of the process. So now, step 3 is looking at my answer options, and I'm looking for what answer option aligns to that number 2 step that I took, right? So aligns to what I understand about this problem, what I understand is happening, what I expect, what I'm using my intuition and critical thinking to discover. And to do that, I always like to see, by looking at the answer options, what do they mean and how does this fit? So A says that it's a common but unhealthy response to the medication. But I know that's not true. I know that it is a common response to the medication, but it's not unhealthy. It's a therapeutic response, if you will. I know nitro causes vasodilation. That's actually what's going to help this chest pain to go away. So it's not unhealthy. That doesn't make sense. And that doesn't go with my expected outcomes here and what I know. Now, this says, this common response will diminish as tolerance to the medication develops. Okay, so I like that. I'm going to keep that because I know that it is a common response, right? I know that nitroglycerin causes vasodilation, which can cause a headache. And I do know that if someone is taking nitroglycerin on a more frequent basis, then as they continue to take the medication, that really bad headache that they get, it's really not going to start it's going to stop rather being so bad over time. So I'll leave that. C says, this is a response caused by cerebral hypoxia induced by the medication. But nitro is not going to cause cerebral hypoxia, right? And considering that we just said it causes vasodilation, then it wouldn't cause hypoxia. If it maybe did something as far as constriction to the vessels, we might have an issue there. But we're not expecting that nitroglycerin is going to cause hypoxia. That's not an effect of the medication. So that doesn't make sense. And D, this is an adverse reaction that should be reported to the prescriber immediately. So it's not an adverse reaction, it's a side effect. So that doesn't make sense. And those two things are very different, an adverse reaction and a side effect. So that's a no for that. So with that said, then my correct answer is B. And that does align directly to what I understand and what I expect of this medication. So here we have B for this question. Now for more information for content, right? If you're looking for some more content support on this, because remember, our critical thinking is a combination of our understanding of our content and our ability to use our intuition to put those things together That's critical thinking. That's what we have to do with these questions, especially with questions that are applying and analyzing level, right? So for more information for content, if you weren't sure about, well, what is Nitro doing that's causing this headache? Take a look at the video that's paired with this to talk about why taking nitroglycerin will cause you to have a headache.